Here we're going to show you another application of how to manage acute injuries with edema, utilizing your high volt pulse current. Rather than using electrodes, you can have the option of using a conductive garment specific to the body part that you're treating. In this case, we're addressing an acute lateral ankle sprain. Okay? The application process looks like this, but we want to make sure we saturate the garment in water, and then of course wring it out so it's just damp, and then slide the garment onto the appropriate site, attach the red lead to the garment, because if you remember the high volt pulse current for an acute ankle sprain or acute injuries with edema requires the red lead and the negative polarity in the waveform that we're going to use. The black lead will attach to your dispersive pad that's placed proximal to the garment. This is how you set up your protocol for this treatment approach. Select electrotherapy, manual operation, high volt, and we select the appropriate channel that we're using. And you see here it defaults to the accurate parameters for this treatment approach. We have a frequency of 120 pulses per second and a negative polarity. We already have the high volt pulse current waveform set up on the unit. I'm simply going to select the amplitude button on the screen. It highlights orange. Now I'm going to increase the intensity for the patient. I want the patient to actually cue me when he feels a tingling vibration sensation. Okay, he's now feeling that tingling sensation. We do want to increase it to more of a motor stimulation. So I'll have him let me know when we achieve that level. Okay, now we're there. So now we can go ahead and start the treatment.